Hello, welcome to Walk, Don't Run to the Doctor with Miles Hassell MD. This is an evidence-based podcast for people who want to use lifestyle choices to avoid preventable illness, as well as to treat illness. Listeners will learn the choices that work for better health outcomes for themselves, the ones that they love, and the patients they care for. We want to see patients liberated from the burden of chronic disease whenever possible. Welcome back to Walk, Don't Run to the Doctor with Miles Hassell. I'm a physician in Portland, Oregon, and this is one of our shorter episodes that we call drop-in visits, because they relate to the common kinds of things that people just drop into the office and mention in passing. And today we're going to be talking about heartburn. And it's really common, one of the most common ailments that humans have, and probably one of the most sensitive to lifestyle change that humans have. And so a patient might come in, they have heartburn, they might be taking heartburn medications, any number of antacids or acid reducers, acid suppressors, and they want a better answer, an answer that doesn't require pharmaceuticals. And so we can sort of think about the big five things that you can do if you have heartburn that will, in most cases, eliminate it. Now, remember that not all heartburn is the same as somebody else's heartburn. So first of all, it's not a bad idea to make sure your diagnosis is correct. And so remembering that things like gallbladder disease, heart attacks, how's that? And any number of upper abdominal maladies can masquerade as heartburn. So remember that doctors are useful for a number of things, including making a diagnosis. So let's say that you do have heartburn. The other causes of heartburn-like symptoms have been eliminated, and you're not worried about complications of heartburn that are rare but seen and don't really apply to this discussion. So those are complications such as bleeding, esophageal cancer, things like that. So you just got a plain old garden variety heartburn, and you're taking Prilosec or something for it, and you don't want to take a medication for it. So the big five are, first of all, pretty much eliminate sugars and highly refined carbohydrates. Dramatically reduce your breads. Almost eliminate sugars from your diet for a few weeks and see what difference that makes. It's amazing how often that alone will eliminate it. Secondly, look at your alcohol intake. If you're having more than maybe 2 drinks a day for men and 1 drink a day for women, then that may well be a contributor. Even those amounts that would be relatively safe in most people might be too much for you. So look at your alcohol, maybe take a week or 2 off of any alcohol intake at all and see what happens. Thirdly, being overweight is an extremely strong contributor to the risk of heartburn. Now, that's not to say that skinny people don't get heartburn, because they do. But if you're overweight, this is a good reason to increase your fruits and vegetables and beans and grains, reduce your weight, and see if the heartburn gets better. And that brings us to a couple of food sources that are really beneficial. Well, the first is fiber. Fruits, vegetables, beans, and grains. When you have more of these buffering foods in your diet, for a variety of reasons, perhaps related to the geometry of the esophageal and stomach interaction, then that is also an extremely strong predictor of less heartburn. So increase your fruits and vegetables, maybe have some fruit or vegetables, beans and grains with every meal and snack, which, incidentally, also is magical for improving weight loss. And finally, probiotic foods. Don't forget that probiotic foods alter all of your gut metabolism. So these are things like yogurt and kefir and fresh sauerkraut. In the area of heartburn, fresh sauerkraut or any other cabbage food may actually be the most effective tool you have. So think about those foods. And also look at any other triggers in your diet. Different people have different triggers. Some people are triggered by peppermint tea. Some people are helped by peppermint tea. Some people are triggered by popcorn. There's any number of triggers that may relate to you that don't relate to everybody else. So when you're thinking about these trigger foods, don't overlook concentrated starches, concentrated carbohydrates that are refined. And the biggest group of those are the foods made with flour. You know, people just overlook this group of the breads, the pastas, the pastries, the pizzas, as contributed for all kinds of health problems, but including heartburn. So if you haven't eliminated or sharply reduced foods made outside the home that have flour in them, that's breads, pastries, crackers, pastas, pizzas, then it's worth doing that for a couple of weeks and just see what happens. You might be surprised at the result. I'm Miles Hassell MD. This is one of the series that we call the Drop-In Visit with the Doctor regarding heartburn. Our practice is in Portland, Oregon. The website is greatmed.org. The book is Good Food, Great Medicine. And the podcast is Walk, Don't Run to the Doctor. Thank you.